Welcome back, my friends. We have heard from so many of you. You want to get the COVID-19 vaccine, but you don't know how this process works. You don't know where to start. Trust me, you're not alone. Mike Lauer is the Executive Director of Emergency Preparedness at BJC Healthcare, and he generously joins us and gives us some time this morning to answer some of these questions that are swirling out there. Mike, thank you very much for giving us a little bit of your time. I know you're ridiculously busy. I want to sort of take this in chronological order. First step, how should people sign up for a vaccine registry?
Well, there's many avenues to sign up, but through BJC Healthcare, you would go to bjc.org. /COVID vaccine. And at that site, you can provide us with your name, your email address, some demographic information, and we will put you into our database. And at some point, as we get vaccine on hand, we will reach out to those people that pre-register and get them a vaccination appointment.
So just to be clear, once you fill out that form and you submit that, you just kind of sit tight and you wait for someone to reach out to you?
Yeah, sit tight. We will provide some periodic communications with you, just so that you know that you're not just in a dead zone of not
Sure.
receiving any information, or just to acknowledge that we have your name and we're still working on this.
I'm sure a lot of people would appreciate those updates. Here's a question we're getting a lot. People will say, you know, I live in Illinois, but I work in Missouri, or I work in the city, but I live in the county. Is it okay to sign up on multiple health department websites or multiple health system websites?
Yeah, absolutely. And we encourage you to sign up as many places as you can. For my parents and my spouse, we've made sure that we registered with the city, with the county, with our healthcare provider, with BJC. When the time comes, and whoever gets the vaccination appointment to you first is the one you should jump with.
I think you may have just answered my next question. Is it okay to sort of sign up on someone else's behalf, say your grandmother or your mom, whatever the case might be?
Yes, absolutely. So my wife's grandmother is 97 years old, lives at home by herself. She's not in a long-term care facility, hasn't had access to the vaccine. She does not have internet access. She doesn't have an email address. So yes, so we made sure that we got her registered on her behalf. But the important thing is that you provide their information within the registry with maybe your email address.
Got it. Okay, yeah, make sure that point of contact is something that's going to work well. I got it. Here's the million-dollar question, and if you can't answer this, that's okay. Just tell us you can't answer it. But how long should we expect? How much time do you think will pass between that initial sign-up and actual appointment scheduling?
Yeah, it could be soon, it could be weeks, it could be a couple months. It just depends on the vaccine supply. I can tell you that the registry at BJC we've had 250,000 plus people register for the vaccine. So they probably registered on several different vaccination sites. So, but yeah, there's a lot of interest in the vaccine among the public.
Yeah, there's no question about that. Before we let you go, one final question. Once your sort of turn in line comes, if you will you be assigned a location, or will there be some flexibility in terms of where you go?
No, so you will get an invite that will provide you with our list of locations where we will have vaccine. It'll give you the dates that are available and some times that are available, and you hand choose. You select which date works best for you.
You think your life's been crazy for the last few months? Take a walk in Mike's shoes. Mike, thank you for joining us. I know your life is probably a whirlwind right now, but really, really good insight. Thank you for that. We're going to post this segment on our website too, kmov.com/greatday, right after the show.